Hello, this is Maggie Whitman from the HomeAssemblyChurch Healthcare Ministry, coming to you today on our Wellness Sunday, sharing on the topic of grief and loss during the COVID-19 crisis. The information being provided today is from the Department of Public Health, Los Angeles County, and Mental Health, entitled Coping with the Loss of a Loved One. As the coronavirus continues to impact our county, our country, our nation, many of us will suffer the loss or have already suffered the loss of a family member or friend. The death of a loved one is always difficult, but during this pandemic, it has been particularly hard to cope with that loss and both the nature of COVID-19 and the steps required to contain the virus pose a unique challenge to us all. The next 4 points we will discuss unique challenges that you may experience. First, COVID-19 deaths did not come after months of illness, but they came on quickly and sudden, unexpected deaths. You and your family may have had little chance to prepare for their loss or to even say goodbye remotely or at all. Secondly, for many, facing death and grief depend on coming together and bringing family together, and being able to share our customs and our rituals of faith as important parts of closure and connecting to others for love and support. But sadly, with the restrictions of COVID-19 and distancing, we have had to find alternative ways to try to connect. Third, you and your family may have experienced thoughts of guilt or worry that you may have brought the virus home, or that you should have recognized symptoms much sooner. The truth of the matter is anyone can carry the virus, and they may be totally unaware. We cannot predict how the virus will affect each person. You are encouraged to understand that you did the very best you could to take care of your loved one during a difficult and unpredictable situation. Fourth, you may also experience anxiety as a result of worry and concerns about the future due to job losses, overdue rents and mortgages, medical bills, loss of health insurance, reduced retirement funds, even food insecurity. These are some of the things affecting families. These concerns can intensify sadness, grief, and loss that come with the death of a loved one and just make everything feel that much worse. It's going down a minute. After the death of a loved one, it is normal for you or your family to experience some of these signs and reactions of grief. I'm just going to go through the list. Possibly feeling a sense of shock and disbelief, or feeling lost, especially if the person who died was a spouse, a parent, an elder, or someone who held as an anchor in your family. You may experience sadness, tearfulness, and depression. In fact, crying is a very normal reaction for everyone. You may experience difficulty concentrating, confusion, trouble thinking clearly, completing tasks, or making decisions. You may have repetitive or distressing thoughts about the loved one and how they may have died. Some experience physical reactions such as difficulty sleeping, upset stomach, changes in eating habits. And children's reactions may include the loss of developmental milestones, sleep difficulties, fears about being separated from their caretakers, and concerns about other family members becoming sick and dying. So here are some suggestions for coping with the loss. Practice self-care. Caring for yourself is very important, even remembering to do basic things like eating regularly and getting enough rest are critical. Getting up out of bed, showering, getting dressed. Give yourself time. Grieving the loss of someone you love is hard work. Don't pressure yourself to try to return to normal right away. It takes time to accept the loss. As you are able, try to focus on the love and savor the good memories you shared with your loved one. Reach out for support. During COVID-19 restrictions on the physical presence of others outside of our homes, it is still so very important to be emotionally connected with friends and family. Come together on the phone or virtually to share memories and grieve together. Seek support from your friends, your family, your faith and spiritual community. Try support groups. Call on your doctor and mental health professionals as needed. Explore healthy coping strategies. Focus on your personal strengths. Practice good self-care. Maintain comforting spiritual practices such as prayer and meditation. Stay sober. Avoid using alcohol and drugs. It's not the answer. Most importantly, take time to remember your loved ones, their accomplishments, their love and care, what they meant to you. When you are ready, share your story. Next, we're going to share some suggestions on helping a child cope with their loss. So when working with children or helping children, be honest, but share age-appropriate information. Remain calm and comforting. Answer their questions honestly, using explanations that are right for their age level. Even young children can be told that someone they loved and someone that loved them has become very sick and died. Let the child ask questions. Encourage your child to ask questions. Share information that is right for their age. Help the children find words for the emotions they are experiencing. Maintain, as much as possible, normal routines, such as mealtime, school time, playtime, bedtime. This helps kids cope better with the loss of a loved one. Be sensitive to any worries or fears. Watch for signs of distress, like sleeplessness, lack of appetite, disinterest in activities, withdrawal or acting out, disinterest in play. Invite the child to talk about it. Express love and reassurance. Don't be afraid to share your emotions together. If a child's distress is long-lasting with no signs of improvement, ask for guidance from your child's doctor, school counselor, or mental health professionals. Do address children's fears about COVID-19. Children may worry that they or their family members might become ill and die. Offer realistic reassurance. Limit the time that children watch TV, especially listening to upsetting TV news. Next, strategies to support someone you know that has been impacted by COVID-19. And this will be closing out our session. Reach out. Social interactions are more challenging during this time, yes, but it is still possible to reach out by phone, video call, social media to stay connected to friends and loved ones. Then listen. Take the time to listen to others, to remind people they are not alone. Engage in shared activities. Doing a shared activity, physically or virtually, helps people remain connected to others. This also helps support healthy coping at a time when your loved one is grieving. Offer a specific help such as picking up or dropping off groceries, or offering to help make calls to let friends and know about the death of a loved one, is more useful than a general offer to help. Your suggestions of a specific help may be welcomed. The following link to this public health message will be provided, with resources included for additional support and help if needed for coping with loss and grief. This ends our presentation. Thank you very much for your time and attention. And God bless you. Sister Maggie Whitman signing out. Until next time, goodbye.